Well, my public health journey actually started clinically, not necessarily public health, but I was a clinician, clinical pharmacist, and functioned like a physician assistant, had a lot of clinical privileges in family medicine with the Indian Health Service, which is a vulnerable, underserved population. And then I wanted to be in a uniformed service, wanted to be in the Navy. Lots of dreams to be a Navy SEAL long ago, and a diver, a Navy diver. And anyway, it took me to the services. And when I went to the Indian Health Service, I found out I could be a part of the U.S. Public Health Service, which was one of the 8 uniformed services. And also I got to do practice the type of clinical practice I wanted. So best of both worlds for me. And so it started off in the clinical realm, and quickly when it grew outside the clinical realm into global health, bioterrorism, health leadership, health policy and education, then it really encompassed a lot of the typical or essential services of public health, and leading a uniformed service that focuses on public health in general was a great fit. To be a senior leader, I was becoming one, but to be a senior public health advisor, I thought I needed a little more content-based expertise. So I enrolled in the program. It was obviously the one that fit my needs the most, and I once again thought it was probably the best education that I had of all the different places I've gone. So the MPH came at a time, as I say, when I was at Pacific Command out in Hawaii and traveling the Asia Pacific primarily for HIV/AIDS and other things that came up. So right in the midst of my sort of capstone experience, and was the first epidemic or outbreak, I should say, not epidemic, outbreak of H1N1 in Vietnam. I believe it was H1N1 or H5N1. And we were working with the Vietnamese military on HIV/AIDS. Well, they're infectious disease specialists. They don't have a humongous infrastructure, but they pivoted quickly, and we focused on pandemic influenza because that was the strains. So that shift to pandemic preparedness, obviously, if I could have rewritten some of the script after COVID or before COVID for it, it would have helped. But we started to teach about pandemic preparedness and some of the emergency measures that we might have to take because of this outbreak, and it was spreading quickly. So a lot of those public health principles that I had just learned, whether it was epidemiology or public health communication or crisis response, all essential services of public health, I was able to apply directly to my position while I was still out in the Pacific. And then right after that, I was given my first star as a 1-star admiral, a Rear Admiral, and I was catapulted into a position where I could really write policy and impact an entire population of the nation. So I had an absolute privilege to work with a number of folks on the HIV/AIDS National Prevention Plan for President Obama. I had the privilege to work on smoking and health. I believe when I was an assistant surgeon general, I had worked a little bit on the National Prevention Plan, which was the first prevention plan ever written in the United States. So that was another good thing. And you get to learn the intricacies of politics and policy and public health. Yeah. I had a year and a half, a little bit longer, as the Deputy Surgeon General of the U.S. It was a privilege. It was truly, like I say, working on population health. We released the 30-second report on smoking and health during that time. And it was the 50th year anniversary of smoking and health from the very first report on smoking and health. And then you had the Ebola outbreak in Africa, which for me was probably the highlight of my career in terms of visibility and austerity and challenges, but one of a few that were a highlight of my career, I would say. To end up in the sort of highlights of my career, in the middle to the end of my career, it was I could actually implement large public health change and have impact on population health. So the name itself, Expeditionary Healthcare, it differentiates us a little bit with some of the other companies. We do tend to have an advantage in having experiences in expeditionary environment. A lot of the leadership here is prior service, and not just clinicians, but operators and folks that have gone through military training and been in these austere environments. So our original DNA of the company was overseas, global, and it had followed conflict and outbreak and the different things that challenge the environment. So conflict in Yemen or Mosul or Ghana, Accra, because of the outbreaks. So it was really positioned to handle this really austere environment. And I always say like attracts like. So the ethos of the leadership team here brings the same kind of people to the company. So we have a lot of folks that enjoy the mission-oriented factor, even though it's a for-profit company. A lot of them have gone back and forth from an NGO, sort of a non-governmental organization that has a humanitarian mission, to a company like this that has a very mission-centric approach to what they do, even though it's for-profit. So I think we've built a good team that feels similarly, and that sort of camaraderie and chemistry amongst the team makes it worthwhile to work here and put in all the hours we put in.